America's epidemic of addiction and how the coronavirus pandemic helped make it deadlier than ever. Today, we learned that more than 100,000 Americans died of drug overdoses in the last year. That is the highest overdose death toll ever recorded in a 12-month period. The U.S. Centers for Disease Control and Prevention said 100,300 Americans died of overdoses between May of 2020 and April of 2021. That is a 28% increase on the previous year. Most of the deaths came from overdoses of the synthetic drug fentanyl. An epidemic of addiction made worse by the COVID-19 pandemic. Lockdowns left drug users socially isolated, unable to get treatment. Drug overdoses now claim more lives than car accidents and gun violence in America combined. And this is truly and tragically a uniquely American story. A comparison with countries here in Europe shows how dramatic the difference is and these figures are. Germany has 1.7 deaths per 100,000 when we're talking about overdose. Norway has the highest total here in Europe, 5 per 100,000. The figure for the United States is 4 times that at 21.1 per 100,000. Yeah, big difference. And for more tonight, I'm joined by Keith Humphreys. He's a professor of psychiatry and behavioral sciences at Stanford University. Professor, it's good to have you on the program. The opioid epidemic existed long before the coronavirus pandemic began. As they began running parallel in the United States, there should have been a completely different response. How do you explain so many preventable deaths in the U.S.?
Well, I mean, we had a terrible problem in the United States, and I have to say in Canada as well, which also has an opioid epidemic of unrestrained prescribing, which went on for about 15 years of drugs like OxyContin and increased our exposure to those drugs by about 400% in a short time. And then once a large number of people were addicted, then there were opportunities for people who make drugs like heroin and fentanyl to expand their business. And now a lot of those users have transitioned over. So we are still losing some people to prescription medications, but mostly, as you said in your setup piece, the deaths are illicit drugs like fentanyl. So it's been a long, horrible road for us, and I'm afraid there's still a lot more to travel.
And the regions hardest hit are also places where we find the most people who do not have health insurance. Politics and policies leading the poor to take pills that kill them. Do you agree with that? Is that an accurate assessment of what's going on?
It's absolutely the case that these deaths are disproportionately concentrated in areas where there's been deindustrialization, where a lot of people do not have work or have only low-paying work. And that is part of the picture that has brought us to this point. But it certainly isn't all of it. It's also an incredible increase in the supply beyond what any society has ever had before. And those two things together were a deadly combination for many Americans.
And is that what explains America's overdose epidemic dwarfing what we see here in Europe? Is it the supply issue?
Well, we certainly had far more supply from the legal medication market, us in Canada, by the way, which also has an epidemic. So about that 400% increase. And you do see something close to it in Scotland, which has more coming from the illicit and heroin supply. But we never had as much exposure in Europe through the prescription system. Also, everybody in Europe has health insurance. Not everyone in America does. So there's people who want treatment and can't get it. That exacerbates the harm of being addicted. It's far more likely that you'll die. And it also, part of it is geographical. We are a very big country. We have a lot of people who live far from hospitals, far from help. And if they have an overdose, it's harder for us to help them than it would be in a geographically compact country.
Yeah, we were talking in the newsroom earlier today about this and wondering why the differences are so stark. And in the United States, it seems that if there's something wrong with you, the first reaction is to go to the doctor and ask for a prescription, a pill to fix it. Here in Germany, it's almost, you get the feeling that doctors are very reluctant to prescribe anything, even especially when you have pain. Is there an attitudinal difference when it comes to treating pain with a pill?
Yeah, in fact, Germany is a very good country to contrast. It has a high rate per capita of using opioids, but they're used almost entirely in hospitals and in nursing homes with a high degree of monitoring. What differs over here is a huge number of people are sent out from doctors' offices with prescriptions on their own, and that easily, many of those make their way into society more generally. Sometimes the person takes them, sometimes they don't, sometimes they are taken by somebody else, sometimes they are sold. And that's probably part of the problem. And you also hit on the cultural thing, which is true, is that there's an expectation of a lot of patients in the United States that all problems are fixable. And that sometimes they pressure providers to write pills, not just for opioids, for everything. And we have ads on TV here, which is not the case in Europe, telling people no matter what your problems are, there's a pill for them, ask your doctor about that pill. And that probably increases the amount of prescriptions that we send out in the world, and also the harms of those prescriptions.
You also see, Professor, the prescription medication advertised on television in the United States, which you do not see here in Germany. If you were to maybe go in the U.S. change that, do you think that it would change the way people look at medication?
Yeah, there's only two countries on earth, it's the United States and New Zealand, that allow prescription medication to be marketed directly to consumers. And I think it's a bad thing in that it does convey that message of there is a pill for everything and you should be taking it, and ask your doctor about it. And, I could never prove that. It's not like we can randomly assign countries to advertising campaigns. But I personally think that is part of the problem of looking to pills for everything, including to solve deep structural problems in the economy, for example, or in society, that really need to be managed at a different level than patient by patient.
Keith Humphreys, Professor of Psychiatry and Behavioral Sciences at Stanford University. Professor, we appreciate your time and your valuable insights tonight. Thank you.
Thank you.